Okay. All right. Welcome to our first episode of, I wasn't even sure what to call it yet, but I'm going to call it Heart Healthy. And it's a great way to start this program because, it's the heart month, it's February. So let's take a moment to breathe, keep a check on our heart status, our heart health. Our society has always been super fast paced and we're always on the go day in and day out. And it's almost like stress is somehow part of the norm as if it's always been now a norm these days. And this is our way of reminding ourselves, including me, to take a pause, listen, and learn to keep ourselves more informed and keep our hearts healthy. So, just a little bit of a background. In 2011, my son Miko was 8 months old at the time when I got the news that my mom had a heart attack. And little did she know that when she felt this elephant on her chest that woke her up, um, little did she know that was actually the sign that will save her life. So she woke up that one evening and thought to walk herself, literally walk herself. It was less than a mile walk. Interestingly, she lived in an apartment that was behind the entrance to this hospital back home in Manila. And so she walked over to the emergency room and she didn't realize that she was already having a heart attack. So this topic is so near and dear to me because after then, I really took it upon myself to look into how one can recover from a heart injury. One can maintain the gains that they have already started with after a heart injury and prevent heart disease. So it was quite stressful, if you can imagine. With my little one in tow, I took him with me and we flew back home, and I was able to help her maneuver through that experience from the hospital all the way to making sure that she's able to do the steps again and pretty much do cardiac rehabilitation. So that's a little bit of our background for me personally. And by the way, my name is Nina. My name's Nina Evangelista, and my background is in physical therapy. I am also a wellness and weight loss coach. Specifically, the passion is in helping people with chronic pain to achieve their wellness and achieving a healthy weight as well. So I'm super excited because we are here today with our co-host Nicole Arcilla, our um, registered dietitian nutritionist, to join me in our conversation about health, heart health specifically, nutrition, and fitness. Welcome, Nicole. Hi, you're on mute.
There. Hello, hello.
Hello. Can you tell us a little bit about yourself, just a bit of your background, and what's in store for us today?
Yeah, sure. So as Nina said, I'm Nicole Arcilla. I'm a registered dietitian. I'm in the DC area, but specifically I live in Maryland. So my background as a dietitian, I started off in a clinical setting. And I was working in long-term care, and actually majority of my patients were those needing heart health attention and heart health care. So I work very closely with a cardiologist and a team of nurses and nurse practitioners, as well as PTs, bringing better care for our patients that were living in this nursing home, as well as our transitional care unit. So yeah, it was always an interesting field. So I spent some time there in my the early years of my career, but ultimately moved more into a food service and wellness corporate setting. And I also have my own practice called Your Gut Feeling. I actually focus a little bit more on gut health, how that impacts our overall health, especially mental health. So kind of all around.
That's awesome. Yes, thank you. Glad to have you. So, do you want to tell them about our agenda for today?
Sure. So, just very briefly, going to chat about what February is all about and how that relates to heart health. And then I kind of want to just touch on some really important nutrients that can impact your heart health in a more positive way. Talk about two different diets that researchers and studies have shown to be effective in improving heart health. And then I want to go through some myths and facts that a lot of people have probably heard, and I just want to give some clarity around it. And yeah, we'll kind of just take it from there.
All right. So as far as my contribution to this episode for today, I will be going over your heart age and what is it, and I'm going to relate it to chronological age and functional age as well. As a PT, like I said, that's my background. I always talk about this with my clients. And then the healthy heart prescription, I'm going to show you a resource and let you know that interestingly, a lot of the things for a healthy heart is actually modifiable, or we can actually control or do something about. So then lastly, I will talk about how much is enough. I get this question a lot for my patients, asking me about obviously physical activity prescription, like how much should I do so that I can train my heart? How much is enough, right? So that's my my piece for today's session. I guess I can dive in, Nicole, on the heart age real quick here. All right. So I'm going to share with them a video. I found this. I mean, obviously, it's nice to know. It's very cute, very short video, I promise. So let me see if I can do this real quick. Share sound. Sorry, you guys. Can you see my, or you see my screen? Did I stop share? Okay, good. Okay, sounds good. So that was your heart age. Yes, there is such a thing as heart age. So most of the times I talk more about, sorry, I talk more about functional age and chronological age with my patients. I do deal a lot with the aging adults, and so I tell them about well, chronological age is how old you are really based on your birthday. And then your functional age, we're hoping that your functional age is, you're younger than your chronological age in terms of your function. And interestingly, that there's also such a thing as a heart age. And there was a study, and I can post the link of the study, that looked at the risks they looked at 10 years risk of someone who is more likely to acquire a cardiovascular disease. And they looked at a heart age calculator. And like I said, interestingly, the reasons why someone's heart age can be so much more than your actual age is because of modifiable risk factors. It could be because you're smoking, you have high blood pressure, you're diabetic, or because you have you're not able to manage your weight as good as we should. So let's take a look at the prescription for a younger heart. It's a heart healthy prescription. That's the next thing that I'd like to show you. So let me show you my screen again. So very simple yet very informative infographic that I wanted to share. Here you go. Do you guys see it? Okay. Is it a full screen? Or not quite? Yeah, there you go. So the prescription for a younger heart, if you look at it, high blood pressure, of course, our goal is to keep that under control. High cholesterol, we always want to look at making sure we're collaborating or coordinating with your medical providers on a treatment plan to manage your cholesterol levels. And diabetes, work with your doctor if you are diagnosed with diabetes to see how we can control that as well. Smoking, if you don't smoke, of course, let's not start. And get help to cease smoking if you do. And then if you have a family member or friends who are smoking, then of course, secondhand smoke is also not ideal or not good. Unhealthy diet, I'm going to defer to Nicole as she talks more about that today. And then physical inactivity, or I should say, if we prescribe, then you should be doing more of the physical activity. And then your healthy weight is another one that is super important. So that's that. Really quickly, I wanted to give you briefly your heart healthy prescription, and I will hand you over to Nicole because she definitely has so much to say about the nutrition piece of our topic for today. All right, you can take it over, Nicole.
Okay. I'm not on mute, right? You can hear me.
I can hear you.
Great, great. So again, just to quickly explain why we're talking about heart health. So February each year is American Heart Month. So although it's restricted to the States, or rather although it's celebrated in the States, definitely not restricted to just our country. It's something we can celebrate all around the world. But yeah, I believe this is the 57th, I want to say 57th annual campaign for heart health. And the reason why so much attention is put on heart health and heart disease is because it is actually the leading cause of death in America. And as Nina was saying, describing that story of her mom, heart disease can also be associated as a silent killer. This is especially true when it comes to hypertension because you don't necessarily recognize kind of those underlying symptoms and that it's slowly building up. But also, as Nina said, there's so many factors that we ourselves can control. It's not just by chance. We can actually take action and prevent, poor heart health and just be more proactive about it. So, as I mentioned, I wanted to just also quickly touch on some really important nutrients that can contribute to better heart health. There's a lot out there, but I just want to highlight kind of the main ones and the best ones. So to start, fiber, definitely fiber. So fiber is a type of carb that we do not digest, doesn't stay in our body. It's something that we pass through. And there are two types of fiber. There's insoluble and also soluble fiber. Soluble fiber is one of the more important ones that for heart health, because what soluble fiber does is it actually can draw in the bad cholesterol in our bodies. And so soluble fiber can be found in foods like oats, barley, nuts, legumes, which are your beans, as well as lentils. And it can also be found in certain fruits, so like apples and pears. And so we want that bad cholesterol to be drawn in to our bulk, to our in order to kind of have that movement and bowel movement. And then we have insoluble fiber, and what that does, it just creates, I guess, some bulk to help pass the waste through our bodies a bit more easily. So, and insoluble fiber can be found more in non-starchy vegetables like your leafy greens, carrots, bell peppers, things like that, as well as whole grains. So you do want both. Soluble fiber, though, is the more important one in terms of improving our lipid panel. So our good cholesterol or bad cholesterol. The other important nutrient would definitely be omega-3s. I'm sure many of you have heard about omega-3s. A good source of omega-3s would be your fatty fish like salmon. I actually have some in the oven right now. So salmon is definitely a great one to have as terms of fatty fish. If you're looking for something more plant-based, that's not fish, or maybe you just don't enjoy fish or you're allergic to fish, you can do plant-based. Which are your chia seeds, your flax seeds. The one thing I want to point out, though, is with your plant-based omega-3s, it has what's called your ALAs, which are not the more optimal version of omega-3s. You actually want your EPA and DHA. That's really only found in salmon, but in terms of plant-based, that EPA and DHA can also be found in algae. Or food that contains algae, like seaweed, for example. So just something to keep in mind if you might be allergic. You can also do supplements for omega-3s. Again, if you don't like fish or allergic to fish, there is actually also that algae derived omega-3 supplement form, if that's something you need to consider. Excuse me. So potassium is another important mineral to consider. Potassium can really help with hypertension in your body, whereas magnesium is also a really important mineral to help kind of bring muscle relaxation into your body. I'm sorry, excuse me, 1 second.
So let me check. I'm checking to see if we have someone joining us actually. So,
Someone at the door.
okay.
Okay, so potassium, again, it's a good mineral to help combat your hypertension, whereas magnesium, another important mineral to help reduce muscle tension. So our heart is a muscle that we need to be mindful of, and magnesium can bring a little bit more relaxation to that. In terms of where you can find potassium and magnesium, it's basically going to be your vegetables, as well as your legumes, again, your beans and lentils. So if you're sticking to more those plant whole foods, you're good to go. Now, putting that all together, there's a lot of diets out there, a lot of trending diets. When it comes to heart health, two should come to mind, which is the Mediterranean diet, as well as the DASH diet that some of you may have heard of. So the DASH diet is actually an acronym that stands for Dietary Approaches to Stop Hypertension. It's very similar to the Mediterranean diet. However, the DASH diet is a little bit more restricting because it places a lot of focus on sodium, since sodium is what can contribute to hypertension. So people do find this to be a little bit more restricting, sometimes a little bit harder to follow because of those restrictions. And that's why the Mediterranean diet is the preferred method. And we have plenty of studies now at this point to show that it is actually more effective than the DASH diet. You really can't go wrong with either, but Mediterranean diet, because it's less restrictive, people will find it easier to follow throughout their entire life.
It's more sustainable, I should say.
Yes, more sustainable. Yeah, exactly.
Got it.
And the thing with Mediterranean diet, although diet is in the name, it's actually more of a lifestyle. We're looking at a plant-based, or you can say plant-forward eating pattern. You have the fatty fish still, you have lean proteins like your poultry. But it's also about making sure you incorporate physical activity, and also you're being mindful of your portions. In the Mediterranean diet, you're not really going beyond that full feeling that you might get. You're kind of getting just a little bit satiated, a little satisfaction there, but again, not going over. So that's one of the reasons why it's so much easier to follow. And also there isn't very strict guidelines like it does for the DASH diet. Yeah. So for next in the agenda, I want to go through some myths and facts, some information that you may have heard floating around there in regards to heart health that needs a little bit of clarification. So the first myth is fat-free foods are healthy. So that's a myth. It's not necessarily true, especially if it's packaged food. So say you're going to the grocery store and you see a bag of chips that say it's fat-free, or maybe some sweets that are packaged are also saying that it is fat-free. That is not necessarily going to be healthier, because when it comes to packaged foods, if fat is taken out as an ingredient, you have to compensate for it by including maybe more sugar, more salt. And so when you have that in combination, then it's not really a healthier product anymore. So it's very important to take a closer look at the ingredient list and see what's really in there. And of course, your nutrition facts panel would be a really good indicator of what exactly is in that food that you're purchasing. The next myth, and this has been very confusing because the studies have changed over time. So the next myth would be eggs are bad for you, especially the yolk. So that is a myth. Eggs can be a really great source of protein. It gets tricky with the yolk because we do know that it is a source of high cholesterol. But what we need to know is, and a lot of people don't realize this, but cholesterol that we get from food does not directly impact our blood cholesterol. Our blood cholesterol is less reliant on what we eat, the cholesterol that we eat. It's more related to the amount of saturated fat or trans fat that we eat, as well as a combination of refined carbs like like sugar. So putting that together is what's really going to contribute to our blood cholesterol levels. So in that sense, eggs are not really something you need to take off your eating pattern. In fact, we have a good number of studies that show those who ate eggs on a regular basis, whether it's 1 to 2, actually show decreased risk of heart disease. Now, if it's not something you've been doing in the past, you don't necessarily have to start tomorrow, eat eggs every single day. If it's not really part of your eating pattern, you don't have to start including it. But if it's something you have been doing, then sure, you can definitely keep it up. But keep in mind too how you're eating the eggs. This is not necessarily eggs that are cheesy omelets with ham and bacon. This could be, scrambled eggs, hard-boiled eggs, baked egg muffins with veggies, and maybe fried eggs, poached eggs, things like that. So don't really wanting to combine it with some of your fatty dairies and fatty meats. So next myth, and it's pretty much related to the last two. Myth, fat in general should be avoided. So as I mentioned earlier with omega-3s, that is your source of healthy fat. So it's definitely a myth because in terms of fat, it's a myth because you do still want to focus on certain types of fat, which of course would be your healthy fats. So omega-3s and other unsaturated fats, which can be found in different oils, as well as nuts and seeds. And I'm actually going to get into their next myth regarding oils. So our next myth here is coconut oil is a healthy alternative. This has also had conflicting information. So coconut oil for sure imparts really great flavor into our food and our recipes. The confusion comes from the fact that coconut oil has a type of fatty acid that is believed to be a healthier form and may contribute to increasing our HDL, our good cholesterol. However, this type of fat actually raises both the HDL and LDL, so our bad cholesterol. So it's raising both. And that's why it's not necessarily a healthier alternative. So something to be mindful of. Again, it's great to put flavor into our dishes. It can certainly be a way to at least reduce sodium, but it's not something you necessarily want every single day. And even when you do cook with it, you want to do it in small amounts. Maybe mix it with a more neutral flavor oil, that so that it's you still have the flavor, but it's not your main source. So in terms of healthier alternatives when cooking oil, olive oil, that's the most common one that people know of. And then you also have your avocado oil and grapeseed oil. Those two are a little bit more expensive, but something really great to have on hand. And you usually don't need a lot of oil anyways in terms of cooking. Um, and so those are really the best ones out there. There is also canola oil, but basically either way, they are still something that you want to have in moderation. Yeah, so those are my myths. And the last thing that I want to touch on, and I think Nita may want to expand on this as well. So thinking outside the kitchen, it is also really important to pay attention to your stress levels and how you're managing your stress. Food, eating regularly, getting as much nutrients as you can actually help reduce stress and mental stress, but you want some other practices as well, whether it's gentle exercises, gentle movements to stretch, help with your breathing, getting enough sleep. So those are just some things to be mindful of and maybe incorporate in your wellness practices. And another thing you may want to consider too are, of course, your different types of physical activity, which I think Nina's back. So, Nina, I don't know if you want to expand a little bit more on physical activity.
Yeah, definitely. I was going to add on to what you were mentioning about doing a physical activity that's actually enjoyable, a very gentle form of movement. We call it blissful movement or joyful movement because it naturally makes you calmer. It naturally switches on your nervous system, the parasympathetic nervous system, so that you're able to relax, you're able to digest and recover. You made mention of sleep, so I just wanted to add on to that because our body needs, in tying it up to nutrition, right? There's what they call the basal metabolic rate, Nicole, and that's kind of the amount of calories that you're going to need in order for you to be able to function in resting state, which means we need to fuel our systems. We need to fuel our body with enough calories, good calories, I should say, from good sources of nutrition in order to allow for our digestive system to relax when we are sleeping or when we are recovering. So and then I wanted to touch on, and thanks for bringing that up again, because I did point it out in the beginning when I was introducing the topic, that it's almost like, because we're always on the go every day, we're always like in and out. I mean, right now we're probably Zoom meeting after Zoom meeting for a lot of folks because you're all online and nobody seems to be late when you're doing online calls, right? Like as opposed to you having to travel and drive to your appointments. So a lot of that adds on to a different kind of stress. And stress is definitely, when you're stressed, your high blood pressure comes in. Your parasympathetic system shuts down. And I told this story in one of the challenge that we just did recently in January. We talked about how our nervous system, when we're always in this fight and flight response mode, we're not able to maximize or actually help our systems to relax when we're in that rest and recovery phase. It's still in like this whole fight and flight response. And what happens is that our blood flow that is needed to go into our digestive system it goes away and it goes into our limbs because we're trying to run away from what it is, what the stimulus is. And if we're in constant stress, it's our bodies in our mind and our body is in constant fight and flight, and that does not help with your heart health. And so hopefully that kind of gives us gives us time to reflect on what are the things you can do to to get yourself in that zone of rest and recovery, parasympathetic switched on. And some things that you mentioned were breathing, and super important, right? Just doing 3 deep breaths before you take a bite, just a gratitude moment to switch on that parasympathetic system is so I think to me has been very helpful. And I have also read that it's also been helpful to incorporate it in a weight loss journey, to just do some breathing techniques. But anyway, thank you for that. I'm going to go into the physical activity recommendation. What the most recent that I have read is that it's still 150 minutes of moderate to rigorous activity, or I should say, if you do 30 minutes a day in 5 days, that's 150 minutes of moderate intensity. Or if you do 75 minutes of rigorous intensity, then that's a good training, or that's a good range for you to train your heart for heart health. And I'm talking about aerobic exercise here. It's in addition to your strengthening activities, in addition to, I should say, things that don't bring, or activities or movements that don't bring your heart rate to that level of challenge. Now, how much is enough is the next question, right? Because they say moderate to rigorous, but what is moderate and how do you gauge? So it's good to have a baseline. And I'm not sure if our listeners, or those who are going to view this recording, if they know to even check just the simple, how do you check your pulse rate, right? You can check your pulse rate here, you can check your pulse rate here, listen to your heart, or you can just use your index and your middle finger and look for your pulse rate right where your wrist is, where your thumb is. Just go ahead and get it's called the radial pulse, and you will feel it. You set a timer, do 60 seconds or do 30 seconds, and it's good to also look to see, is your heart beating in a regular rate, right? And then you can record that. And that's something that you can use to assess for the intensity level of your exercises. Because there's one way to do a target heart rate measurement, where you really look into the specifics to get a more accurate, I should say. It's not as accurate, but it's just a guesstimate. It's an estimate, but you're trying to be as objective as possible. There is such a thing as, well, 2 ways I'm going to share with you today. One is more of a subjective way of knowing when enough is enough in terms of aerobic exercise, and that is using a scale called the rate of perceived exertion, or RPE. It's Borg rate of perceived exertion. The scale is originally 16 to 20, but to keep it simple, and as years went on and they tried to simplify it for our for consumers, for us to be able to understand how to score it, if you're going to use the 16 to 20 scale, and you can look it up, Google rate of perceived exertion, and there's going to be scales available for you to use. One could be a 16 to 20 scale, and another one is 0 to 10 scale, or 1 to 10 scale. What's the take home for those scales is that if you are going to scale or score your activity, here's how I'm going to ask my client, right? And let's say you're doing a physical activity, you walked around a loop, you ask yourself from 0 to 10, or from 16 to 20, and you can use that as a guide, that scale. How much exertion or how much effort did you put or did you do with that activity? How hard was it for you from 0 to 10? 10 being like the most difficult thing that you've done in your life that you never want to do again because it's super difficult and it's hard. And whether it's muscle fatigue or you're out of breath and you really don't want to do it again, that's 10. That's maximum. And 0 is no effort at all. No effort at all, meaning you can do this multiple times, 100 times, and it should be fine. You're just resting. So what they're saying is that if you scored an activity, if you use the 6 to 20 scale, if you scored it between 12 and 14, that's moderate intensity. If you scored 3 to 5 in the 0 to 10 scale, that's also moderate activity. So that's a good training range for you. Now, the other way of doing it is using the target heart rate formula. Some of you may be familiar. If you've heard of maximum heart rate, that's the 220 minus your age. So let's say you are, help me here, if you are, let's say 50, for example, 220 minus 50 is what? Minus 50 is 170. So that is your maximum heart rate, but you don't really use this because it's not a very accurate way of predict or of shooting for that target. They have a moderate intensity range, which is, I want to make sure I give you the most recent one that I have picked up. It's 64 to 76% of your maximum heart rate. So there's some form of calculation that happens, and then you go and check your heart rate. So now you have your base, your 220 minus your age. That's going to be the maximum heart rate as an estimate. And then you know your resting heart rate as a reference, and then you get your 64 to 76% range. So you do, in this example, at 50, let's say it's 170 times 0.64, and then you get your, that would be 109 beats per minute. And then the top end of that range would be 76%. So then that would be 170 times 0.76, which would be 129 beats per minute. So that's your range. So if, let's say, your resting heart rate is 60 beats per minute, right? And your moderate intensity range is 109 beats per minute to 129 beats per minute. If you're doing an activity, say you're brisk walking, you check your heart rate, and then you look at that if it's falling between those ranges in order to get your prescribed moderate intensity exercise. And if you do that activity 30 minutes for 5 days, and that's great. So another just point that I wanted to add, if you guys have or are on medications that that help with managing heart rate irregularities, if you have AFib, if you know that you're taking something that changes the way that your heart rate is beating and the frequency that it's beating, then using the target heart rate formula may not be the best for you to use in terms of finding out how much activity or how intense this activity is for your heart, because it's being masked by the medication that you're using. So that is why I talked about the rate of perceived exertion first, because we use that for post-op patients after they have had their open heart surgery or valve replacement or whatnot, or even just joint replacement, and they have existing comorbidities that they take high blood pressure medications. It is a safe range for you to use, the 0 to 10 scale. And if, again, the best training range for moderate intensity is 3 to 5. So that's my piece for physical activity prescription and for checking to see how much or how intense your physical activity is and whether it's a safe range for you. But wait, there's more. I forgot. I remember there's another one that I wanted to bring up, because then it comes to the point we're in. You see, I'm a PT and I see patients and I just don't see them, after they're a lot of the times they're not coming in just because they want to improve their aerobic capacity or their endurance. They may also have pain. So now we consider this, let's say you have back pain, you have knee pain, you have ankle pain, how does that now relate to your physical activity prescription? So sometimes it's a case to case situation. So somebody has to be helped individually in regards to achieving the optimal physical activity um, dosing for them, and what kind of activity would be best. Would it be walking? Would it be riding a bike? Or um, doing some high intensity interval training that gets your heart rate up, doing jumping jacks? Would it be okay for you to do that? So those are the things that would be good to touch base with your healthcare provider, get a baseline, especially if you have not seen a medical practitioner for, say, 5 years, and you want to start an exercise program or engage in something that you probably saw online, or join a 5K suddenly, right? And you try to build up your endurance. So, of course, it's best to have a baseline, get in touch with your healthcare provider, and then seek help figuring out what is your baseline and then how can you proceed. Because the approach to your physical activity recommendation may not necessarily be the same for you and for another person. So that's my input. I think I got everything out, Nicole. So thank you guys for joining us this evening. Did you want to add something else, Nicole? Let's talk. Do we have any questions, by the way? I know Byron is with us also today. He is helping us, and I'm so happy that we had a participant who was able to make it here in the Zoom. Just wasn't able to look at Facebook at all. So anything else you want to add, Nicole?
I actually was reminded of something as you were talking about kind of our daily lives. We're very much on the go, go, go. And then you started talking about heart rate, and I realized, there is one thing that many of us, if not all, rely on to keep going, and it also increases our heart rate, which would be caffeine. Yeah, so that's definitely an important one I want to touch on. Now that you mentioned kind of our daily life. Yeah, so caffeine is a stimulant, everyone. So it will stimulate just about everything in your body. I know some people like to use it to kind of get their bowel movements going in the morning, which is perfectly normal. Definitely can assist with that, but be mindful too of what your tolerance level is. The recommended amount for coffee on a regular basis is about 4 cups a day. Most of us don't reach that, thank goodness. And especially if you are at risk for heart disease, or you're already having some trouble with even anxiety, and not being able to reduce your stress, caffeine may be something you want to slowly take out of the picture. And there are certainly other ways to keep up your energy levels, because we know, one, caffeine may be masking your need for sleep. A lot of people will say, oh, I'm fine, I don't feel tired. Well, have you checked how much caffeine you've been having lately? Maybe you're just not recognizing that you are in fact tired. Your body needs that rest, so you can have more natural energy. And then the other thing too is just focusing on those high fiber foods, especially your high fiber starches. They'll help you give a steady flow of energy throughout the day. And also making sure you hydrate well with water, and really limiting those sweetened beverages. So those are some really great ways to make sure you keep up your energy without having to rely on high caffeine sources. So yeah, that's what I wanted to touch on now that I was reminded.
Yeah, thanks for reminding me. I do love my coffee. Thankfully, I don't have to do 4 cups of coffee
Yeah.
to keep
And
my.
again, it depends on your tolerance level. Some people just need maybe a little bit, a half a cup or a full cup just to get their day going, and they don't feel that racing heart. They don't feel that anxiety and high stress moment, those jitters essentially. Whereas other people, they need something a little bit less. So you could always try low if you're used to coffee, but you feel like you need to do a lower dose. You could always explore teas as well. Most of them still have caffeine, but not to the extent as coffee would. So you can always experiment with that too. Yeah.
That's awesome. Yeah. What do you do for stress management? Tell us.
Oh, a lot these days.
Oh,
um,
we all need it, like
yes.
the tools. Yeah.
Yeah. Trying to make it a habit to do some gentle movement in the morning. I'm not a very big morning person, so exercise isn't always a big thing for me, but even just stretches, and for me, that looks like a few yoga poses, even if it's just 5 minutes right when I get out of the bed.
So,
Um, and on top of that, you know, definitely having about 16 ounces of water right when I wake up too, because it's kind of also my alone time in the kitchen, just drinking water and kind of checking in on my phone. And then I always make sure that I have something to eat in the morning, even if it's just like a small bowl of oatmeal, a little bowl of fruit, yogurt, mainly because in order to reduce my stress, I have to not be hungry.
that's
And that's really the big thing.
hungry. You
Yeah,
don't want to be
hungry.
hungry. Yep.
Exactly. Yeah.
Yes, that's true. That's great. Thank you for sharing. I actually love my sleep. So I try to get my 7 to 8 hours of sleep that's recommended, if not 9 hours. But no, I really usually maybe barely 7 hours, barely, but I try to get that in because I really think that it rejuvenates me first thing in the morning. I do want to work on the water intake again. That's always my case, but we can go on and on about this. It's something that is super important, and it's very um, something that we can always touch upon because we always tend to forget about ourselves, especially when we're caring for other people. We, as a healthcare provider, or someone who's helping other people become well, and what our tendency is to forget about self care and self love. And so that's kind of um, it's always good to reel ourselves back into that so that we can help more people when we help each other. I mean, when we help ourselves first. Yes. So, with that said, anything else that you want to share? Anything else that I think we've touched upon a good amount
Yeah.
of
Yeah.
stuff today. So we can we're doing this, guys, every month now. So watch out for our next talk with Nicole. I'm not sure exactly what we have for the next one lined up, but do look out for that. We'll send you guys a post on Facebook. Follow us. We're also on Instagram. We're trying to figure out how we can be live on both platforms. Yeah, Byron just sent me a message. It's nutrition month for next month. Yay! That's Nicole again.
Is
Yay!
National Nutrition Month in March. So look
So
forward to that.
ever since I've been a PT since it's been a while, but um, I've evolved, and I really see now the very important link between nutrition and physical activity, nutrition and pain management. And this is why I'm really advocating and making sure more people know about it, and take advantage of you know programs like this so that we can bridge that gap and hopefully create a more holistic approach to looking at things, whether it's weight loss that they're looking for or becoming fit physically, and or pain management. So just tying it up together, because gut health is super important.
Yep.
Yes, for sure. I agree so much. But anyway, thanks for joining us, guys. Till the next we still don't have a name for the program.
We'll figure one out.
We'll figure one out. We'll figure it out and we'll let you guys know. All right. Take care, everyone. Thanks for joining us. And
Thank
for those who are
you.
going to watch this on the recording, I hope you found value in the session for today. Take care. Thanks, Nicole.
Thank you. Bye.
Bye.